Hello, this is my OTKE Remediation Workbook assignment. The questions I found today are from the Therapy Ed Edition 9 book. Question 1. A carpenter incurred a short below elbow amputation. The client plans to return to work. Which components would be most important for the occupational therapist to recommend for client's prosthesis? The answer to this is a fixed elbow socket and heavy-duty secreted grid terminal device. A fixed elbow socket provides stability. With this patient being a carpenter, he or she will likely need a heavy-duty secreted grid terminal device to hold tools and nails. Question 2. An individual with schizophrenia experiences hallucinations. Which action should the occupational therapist take when the individual begins to actively hallucinate during an occupational therapist project group? The answer to this is redirect the individual's attention back to the project. The rationale: the best action to take when a person is experiencing hallucination is to redirect the attention back to the project in which the person has been engaging in, using a calm, matter-of-fact tone. This can help the person focus on reality. Question 3. A 5th grade student is having difficulty self-feeding and frequently spills beverages. The student has a non-spastic cerebral palsy resulting in fluctuations of muscle tone and poor motor control. Which is the best for the occupational therapist to recommend the student to use to improve independence in self-feeding and minimize spillage? The answer to this is a straw. The rationale: a straw to drink from a bottle, glass, or cup is an easy and age-appropriate adaptation to prevent spills. The therapist can advise the student to carry a stainless steel straw in their backpack in case straws are not available. Question 4. A client has a 3-year history of multiple sclerosis. One of the client's disabling symptoms is a persistent and severe dialopia, which leaves the client frequently nauseated and unable to complete desired activities. Which adaptive strategy is most effective for the occupational therapist to recommend the client to use during basic and instrumental activities of daily living? The answer to this is to wear an eye patch on one eye. The rationale: double vision or diplopia can be managed by patching one eye. Patients are typically on an eye patching schedule that alternates the eye that is being patched. Question 5. A patient recovering from right total hip replacement, posterior lateral incision, cementless fixation. Which is the best type of bed to wheelchair transfer for the occupational therapist to teach the patient to use? The answer to this is a stand pivot transfer to the non-surgical side. The rationale: during the initial healing, it is important to protect the hip from dislocation or subluxation of the prosthesis. With a post-lateral incision, excessive hip flexion, internal rotation, and abduction past neutral are contraindicated. Thank you for listening to my questions and my answers and my rationale.